In the literature, I was reading where they're saying you may want to come back in a month for a touch-up. Is that something that you find is needed?
I think that is oftentimes the case. We generally don't want to go overboard in any one setting and say, oh, gee, that was too much, and we got to wait, a year or two for it to resolve. So the tendency, especially the first time someone has received some of these products, we typically want to be on the conservative side, let it incorporate, let it rehydrate on the inside, as I discussed previously, and see where it ends up. And if it needs a little more, then we do it. And kind of there's always a little learning curve on each individual on what seems to be the right amount for them, and then those will be sort of the starting points for future treatments, years down the road.
So what can I expect as far as any kind of bruising, and how long would that last? Can I go out in the public?
Yeah, certainly you can go out in the public. Anytime you're putting a tiny little needle through the skin, it's not really the product, but just the needle stick can sometimes cause small areas of bruising, which is not common, but not uncommon. Typically speaking, little tiny skin bruises that occur will be gone within a few days. If there's any little bit of bruising, you don't want to get much sun exposure to that area because it can cause it to hyperpigment. But beyond that, there's really no restrictions, and not that I encourage it, but some people will go do an exercise workout when this is done, and without any real side effects. So bruising can occur, doesn't occur all the time, not common, not uncommon, and it does resolve very quickly.
While this may not apply necessarily to me, but when women are having this, they may be concerned, can they put makeup on right away?
Yeah, we like them to kind of go home from here, and settle in for the evening. But yeah, they can certainly put makeup on the next day without any problem. And if in a bind they need to put it on that evening, it's fine also.
But Dr. Scott, I want to say that the procedure for me was really quite, I barely felt any of the pricks at all from the needle. There was a couple of them, but it was really quite comfortable. And I think there's, that justifies coming to a plastic and reconstructive surgeon for even an injection therapy, because you have training, you know what you're doing. The smoothing out of this, I think, will make a difference. And when people are looking today, and there's lots of things and lots of people out there, I think that's something important for them to think about.
Well, thank you. I agree with you. I'm biased, however, but yes, I do agree with you. So.
Well, we'll see you in couple weeks, you said?
Couple weeks. We'll take a look at it and see how it looks in a couple weeks, and see if we're done, or see if it needs a little bit more.
All right, great.